from the College of Rehab Sciences at UTEP, and today we'll be talking about persistent depressive disorder. But first, we are going to introduce ourselves.
Hello, I'm Megan Treviso, and I'm a speech concentration.
I'm Jasmine Stewart, and I'm an OT concentration.
I'm Samuel Womack, and I'm a OT concentration.
I'm Ethan Orihuela, and I am a PT concentration.
I'm Silvia Chavez, and I'm a SLP concentration.
And I'm Edith Martinez. I'm OT concentration. And as we said, today we're going to talk about persistent depressive disorder. So to begin with, I think we are pretty much related to what depression is, right?
Oh, yeah.
We have experienced it once in a life or twice. And persistent depression disorder is not different from the depression that we experience. It is characterized by the same symptoms as eating disorders like lack of appetite or overeating, changes in mood, irritability, low self-esteem, changes in sleeping schedule like insomnia, hypersomnia, fatigue, low energy, and lack of concentration. So PVD is specifically characterized by its period of lasting. While in a major depressive disorder, it is characterized for lasting about a day or a couple of weeks. In persistent depressive disorder, it is characterized by lasting between a few months to, at the very least, 2 years.
Wow.
There is a lot. Another characteristic that PVD have is that the symptoms are not as intense as in a major depressive disorder. So the symptoms are in a mild level. But because it's not as intense, it doesn't mean that we don't have to pay attention to it. In fact, PDD can transition it into a major depressive disorder, and this is when most suicides tend to happen. As for the causes, there is no exactly a specific cause for it. Although it's said to depression runs in families, if you have a member who suffers from depression, it's more likely that you, at some point in life, you might suffer from depression. It tends to be that is due to life events. As we know, life is difficult. It has a lot of, up and downs. And one of the main causes could be stress. We're related to stress, we know what stress is, and we know how powerful the stress can be. So, Megan, can you tell us about the statistics?
Yes, I'll go ahead and talk about the prevalence of persistent depressive disorder. An estimated 1.5% of U.S. adults had persistent depressive disorder in the past year. It affects approximately 1.5% of children and 8% of adolescents. An estimated 2.5% of U.S. adults experience PDD at some time in their lives. Regarding gender prevalence, this was higher in females, going at 1.9%, than for males at 1%. So how are the lifestyle changes for someone who has persistent depressive disorder?
So, as with any other disorder, there comes some changes that have to occur in a daily life. So, I guess the main recommendation that they have is for people to start, talk therapy, which is basically also called psychotherapy. With this therapy, it is also recommended that the person gets a good night's sleep, which I know sometimes it's really hard to do.
Especially as college students.
Yeah, exactly. And also to just maintain physically active, and I think this mostly ties into just keeping your mind off of things, just working out, going to the gym, or even just taking long walks. I know that it was something that was really important. It is also recommended to keep a healthy diet, as like Edith said. It is very common for a person with this disorder to just binge eat, and that can also lead to bigger health problems. So it is recommended to have a healthy diet. And it's also important for the person not to engage in alcohol or other recreational drugs, because although that may lower the symptoms, it can also lead to bigger problems, which is, alcoholism, recreational drug use. So something else that I found would help the lifestyle of a person with this disorder is journaling. I feel that sometimes it's hard to talk to somebody about what you're feeling. So when you have it down on paper, I think it's easier if you don't want people to find out about something that you're going through. It's always just easy to just tear off the page and throw it away. And that's kind of, I guess it's like a big part of, I guess, the therapy itself. But if a person finds that, all this is not working, they have to move on to a bigger change, which is medications, which actually I know that Ethan would know a little bit more about that. So I'm going to hand it over.
Of course. So for persistent depressive disorder, there's 3 main medical interventions. The first would be selective serotonin reuptake inhibitors. So these would work by increasing the serotonin within our brain. Serotonin is a neurotransmitter, and it's believed that it helps influence our mood, emotion, and our sleep. The second form of medication that most people would take is tricyclic antidepressants. These medications function by inhibiting the reuptake of neurotransmitters such as serotonin and norepinephrine, which can modulate mood, attention, and pain in individuals. So this is often why you would see when people take antidepressants, they're often they say they're a bit drained and a bit more calm. It's because their either uptake is too high to the point where they don't feel it anymore, or it's too low where they do not feel it anymore. And then the third medication most people would take are serotonin and norepinephrine reuptake inhibitors. They treat depression and anxiety, and they work by raising levels of serotonin and norepinephrine in the brain and improving mood and other depressive symptoms. It takes time to figure out the right dosage and combination for medication that works for everyone. It is believed that it may take 2 to 3 weeks before you eventually figure out what is going to happen. It is recommended that you always read the label and make sure to be in contact with your physician at all times, because the dosage that works for someone else may not work for you. And it's important to, when you're in therapy, that you should be taking medication with it. It's important to talk to your therapist about this and help them understand what you're going through at any given time. So, Jasmine, what would be a real-life example of persistent depressive disorder?
So I found a case study that was based on a 14-year-old female. And just to talk about that, it's really upsetting how young a person can be just to have that disorder, just to have any disorder, but especially persistent depressive disorder at the age of 14. This was done by Hyperion University, and they interviewed the girl, and they said that when they first saw her, that she was actually, she looked very cold, very pale. She looked dry in a way. Her hair was thinning. She looked very skinny. And because what she had anorexia and OCD as well as PDD. And just having that while being 14 years old, it must be a lot. So we know that with anorexia, you starve yourself. Or even with the opposite of that, you're binge eating. But anorexia, you starve yourself because you put yourself on a pedestal. You put people on a pedestal who are models, very skinny models, and you're just like, well, I kind of want to be like that. Mm-hmm. Or you've been bullied, called ugly and fat, and you just want to be the opposite of that. And with her, it wasn't necessarily that she wanted to be skinny. It was just the fact that she actually wanted to unalive herself. She wanted to starve herself so that she could eventually decay in a way. And she did this because she felt worthless and she felt like a bad person with her recurrent intrusive thoughts. And I like to point out that there's a difference between intrusive and impulsive thoughts. So intrusive are basically unwanted and disturbing thoughts, while impulsive is just spontaneous and emotional thoughts. So they're not interchangeable in any way. And so the way she made herself suffer, as anyone does with suicidal thoughts, they commit self-harm. And a little content warning, she cut herself repeatedly. And what she also did, she kept hitting her feet, and bruises would appear, and then she would end up pressing on them just to feel pain. And I thought that was very upsetting because no one should go through that. I mean, nobody deserves to hurt themselves like that, to want to hurt themselves like that. She then became antisocial, and she experienced insomnia because she couldn't sleep. She had all these recurring thoughts of wanting to unalive herself. So how this started was that she was bullied 2 years prior, and she felt like she was pressured into getting high grades. And I think that happens with a lot of us, just because our parents want us to do well, get a good job. But at this point, she felt like what she was doing wasn't enough. And even they talked to her parents about it, and they were saying, like, we just wanted what was best for her. Like, we wanted her to do well in school, and all she felt was just, if she didn't get good grades, her parents didn't love her, pretty much. So during the interview, they had her take a lot of surveys and questionnaires about it, and she pretty much got a lot of negative scores, pretty much. So there was this survey they had her take, a psychological test, which is CAS++, and she got a low score in the extroversion scale. So being extroversion means that you're active, you're talkative, you're basically an extrovert, pretty much. And then she got a low score on the agreeableness reflecting self-centered attitude. So as you may know, like, that means she didn't really have a lot of self-esteem, self-love for herself. And then she got a low score in emotional stability as well. They said that she was, like, emotionally unstable just because she couldn't really feel happy. All she felt was depressed, and she felt like nothing she could do could ever make her feel, something positive. And they had her take a lot of questionnaires that she, not necessarily like she got low scores on, but they weren't like the best. They were negative, pretty much. So after all that, they encouraged her to do therapy. They encouraged her to, like, do some exercise. Exercise is very important no matter what condition, or if you have no condition, exercise is very important. They had her go on not necessarily a diet, but they did try to encourage her to eat more. And then they helped her take some medication to reduce the thoughts, the intrusive thoughts of what she had with her OCD. And, like, this isn't a cure, honestly. There's really no cure for this. Because even after 5 years and after, like, amazing progress, she still feels the same. She doesn't feel the same exact way, but she still feels it sometimes. That's why it's called persistent depressive disorder, because it's still there, and it's always still going to be there. And she just needs time, really. But I would say if you're going through something like that, we do encourage you to talk to someone, to call the National Suicide Hotline as well. Or, I mean, if anything, you can always do journaling. Like how Sylvia said, you can always journal. You can always just do things you think are good for yourself, in a way. And so, what do we have as a take-home message, Sam?
I think a good take-home message for this would be that you're not the only one who's, like, if you do have this condition or you think you have this condition, obviously seek help, seek professional help. If you do get diagnosed with it, make sure that you know that you're not the only one dealing with this, that there are other people who are also dealing with this, that people will understand what you're going through, and there's treatment for it. You can change things in your life. If that doesn't work, you can take medications that do often help people. And of course, if you're in a tough spot, do seek help, talk to other people. There are hotlines you can call and talk to. There are counseling services. UTEP has a free counseling service. If you are a student at UTEP and feel that you might relate to some of these things, seek out help, reach out to people. You're not doing this alone.
Yeah. Even if you think nobody cares about you, there are actually a lot of people who care that if you leave, honestly.
Definitely.
I'm sure some of us, maybe a lot of us, have experienced maybe someone close to us committing suicide. And it's unfortunate that, I'm not saying that it's your fault. It's not. It's nobody's fault for committing suicide. It's nobody's fault for feeling this way. It's just you don't realize the impact you have on a lot of people a lot of people who care about you, at least. Because I know, I mean, I assume that we all had like some sort of experience like that, or at least some of us, like Edith and Sylvia said, like we all sometimes go through a depressive state. Sometimes, again, don't self-diagnose yourself, please. But yeah, we all go through it. I mean, and we're all here to help each other. Honestly, I say we just keep it kind. We keep sharing the love.
Definitely. All right. Thank you guys for joining us.
Thank you so
Thank you.
much.